Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that assists nurse practitioners with employment contract and independent contractor agreement issues. Today I'm going to talk about nurse practitioner signing bonus repayment risks. So, if you are either just newly licensed as an NP or you're switching jobs, many times the NP will receive some kind of signing bonus. And I'm going to talk about the details of what normally comes with that. So the timing of the bonus should be listed in the contract, meaning are you paid it upon signing the contract? Are you paid it? The most standard way of doing it is paying it within the first pay period after you start providing patient care. Or perhaps it's more of a retention bonus where you'll receive it after the year and then you will get it. But if you receive a bonus in advance of starting, either once you sign or maybe in your first paycheck, there's almost always going to be language that states you have to stay for a period of time or you have to pay it back. So what's a normal period of time? I would say 1 year would be the most common kind of forgiveness, meaning if you stay for 1 year, you don't have to pay back any of the signing bonus to the employer. Some will try to stretch it out to 2 or perhaps 3, but ideally you wouldn't want it any longer than a year. And then the interval with which it's forgiven is important as well. Some will say, I'll just use an example of, let's say it's a 2-year forgiveness period, or you have to pay the entire thing back. Well, that's not really fair in my mind. It should be prorated in some way. And so ideally you would have monthly forgiveness, meaning if it's a 2-year forgiveness period, 1/24 of whatever you were paid via the signing bonus is forgiven. And therefore, if you instead of an all or nothing and you leave in month 23 and you have to pay back the entire amount, if it was a monthly forgiveness, you'd only owe 1/24 of the amount that's outstanding. So it's not a red flag. It is absolutely common. I mean, from the employer perspective, you don't want to bring somebody into your job and then pay them a bonus and then they leave after a few weeks. So you can absolutely expect, and it's completely normal for the employer to want you to stay for some period of time before having, to repay it. But how long that lasts and then whether it's prorated or not are kind of the variables that you definitely can negotiate in your contract. One other thing, you're not going to receive the full amount. It's going to be taxed. So if you received a $10,000 signing bonus, you're going to get $6,000 or $7,000. You're not going to get $10,000. However, when you pay it back to them, or if you had to pay it back, they expect the gross amount, the full amount, not the net. So some are surprised where it's like, well, I only received $6,000 and they want me to pay back 10. Yep, that's just, that's the language in the contract, then that's what you're gonna have to do. Now, you can get that money back if you had to repay the full amount in your next year's taxes, but you'd have to get with your accountant and make sure it's all accounted for. So that's kind of one thing to think about as far as repaying a signing bonus. All right, that's about it as far as the risks for repaying a signing bonus as a nurse practitioner. If you have any questions about your employment contract or independent contractor agreement, feel free to contact my law firm at the information listed below in the description. And I appreciate you watching the video. All right, thanks. Take care.